It's possible you've heard about NUCCA Care. Maybe it was right here on this show. A lot of people turn to it for help with neck or back pain.
Here's a twist, though. Upper cervical care can also improve athletic performance.
Here to explain how, Dr. Drew Drummond from Spinal Balance Health Center. Good to see you,
Hi,
Doctor.
Dr. Drummond.
This is something I don't think we've really talked about before, the connection between NUCCA Care treatments and then maximizing somebody's athletic performance. How does that work? How do they work together?
I'm surprised we haven't talked about it before because it's probably one of my favorite topics to talk about. But to explain how the connection between the symptoms that I usually talk about and how that affects athletic performance, we always have to go back to what is happening at the top of the neck. So there is an atlas bone at the top of the neck that, when misaligned through some kind of an accident or injury, will interfere with the nervous system. And part of that problem translates out to posture because nerves control back muscles. So if you look at this picture, you'll see what a person that is not misaligned and is normal is on the right-hand side, where you see the muscles pulling evenly on the framework, the shoulders, hips, legs, they're all nice and even and symmetrical. But on the left-hand side is what happens during an upper cervical misalignment through an accident or an injury. And it pulls the muscles on one side of the body closer together, so you see uneven hips and uneven shoulders, and then way down at the bottom, a short leg. And that then forces the body to have to adapt to that short leg, which puts stress in different areas of the body, typically the weight-bearing joints, neck, low back, hips, knees, ankles. And so while that causes neck pain and back pain as a person gets older into their 40s and 50s and 60s, if you're an athlete and you're putting all of that stress into your body 5 and 6 and 7 days a week, you end up with all the same problems that people would have when they're 50. And it not only affects the way they can perform because of the pain that they're in and having to take breaks from practice, but it also affects the way their dexterity, their hand-eye coordination, their proprioception. It affects every aspect of their biomechanics.
What types of athletes do you work with? I'm thinking about, as you're speaking, I'm thinking about runners, golfers. Who do you see?
Yeah, I used to be a runner, so I always go there first because that's what I think of. But if the biomechanics is off, and you'll lose an inch on your stride. So if you're losing an inch on every stride, even on a 100-meter dash, that ends up being about 2 meters. And so how many races are won or lost in 2 meters? If you extend that out to a marathon, it ends up being about 1,200 meters, 3 laps around a track.
And how many more steps do you got to run? I mean, that's a lot more steps.
And plus, when you're imbalanced, if you're symmetrical, your bodies don't have to fight as hard just to stay upright. But once all of your muscles are adapting to an imbalanced posture, it's harder to work and you fatigue faster. So we get a lot of golfers. Well, golf is a game of biomechanics, and small problems in the tee box end up being huge problems 250 yards down the fairway. We've had baseball players, softball players, I've had basketball players that have improved their vertical jump 10 inches after the adjustment.
What?
Yes, it's amazing. We just had, if you guys know who Aubrey Baxter is, she's with Team Nebraska. She just competed in the Olympic hammer throw, or the Olympic trial hammer throw. She got 7th, which is, I mean, she's disappointed because she didn't make the team, but it was fun to be a part of that. UNO hockey players, Stars hockey players, UNO volleyball players. It's high-level athletes. They find these little improvements just give them that edge.
What about us weekend warriors? If we want and I guess what percentage of athletes out there have some sort of misalignment with that bone at the top?
If I went out in public, I would see 80 to 90% of the people, just average Joe, that have a misalignment. It's the same with athletes. It's going to be 80 to 90%. But more of the people that come into my office, they're not world-class athletes. They're people that want to keep playing on their beer leagues, softball league, their volleyball league, keep walking.
Dart league.
Yeah, they're
bowling.
Darts, it affects hand-eye coordination.
No, but bowling,
bowling.
I feel like it's just life in general. It's the stuff you enjoy doing, but then you say, I can't do it anymore because of...
I've heard every single athletic event that you can mention. I have had people in my office that have said, wow, I can't believe I'm bowling better. I've heard that one. It's not just for this elite athlete, for sure.
So I guess for people who are watching now, how do they know if they say, yeah, I feel like this would be great for me? Or for your young athlete at home, because it really is an ageless treatment, NUCCA Care.
Yeah, I would look for people that are having chronic problems that are being exacerbated by some kind of an athletic event that is the same kind of chronic problem that people have when they're 50 and 60 and 70. Those things shouldn't be happening at an early age. But if their body is stressed, that is exactly what will happen. And then if they look at their posture and see the head is tilting, the shoulders are uneven, I mean, those are telltale signs that there's a body imbalance.
Yeah, it's not just for athletes who want to get out there and improve their game, but it is for everybody who may have some sort of misalignment.
Yeah, yeah.
If you're already like in PT therapy or some type of regimen already, can you still do NUCCA care to complement, or is it one or the other?
No, in fact, I see other types of athletic chiropractic injury care, physical therapy, massage therapy, even pain management that a medical doctor would do. When we get the body straightened out and that imbalance isn't feeding stress into the injured area, they seem to have a better time with what their therapy is, whether it's massage, physical therapy, chiropractic care. It all enhances
So you don't have to pick, you just add this in and get a better result.
Just add it
and we've
in,
got this offer from Dr. Drummond. He's so generous with our viewers. The first 15 people who call his office receive a consultation, exam, and x-rays, that whole bundle, for just $50. So you can say for certain if you're a candidate, if you could benefit from NUCCA care.
Doctor,
Hey.
good information. I'm glad we talked about this, because there's a lot of
Yeah.
people out there, not just world-class athletes, but people like me who like to get out on the golf course on the weekends that may have some issues.
Former
We'll give you a few more
soccer
yards on the
Former
drive.
soccer stars, that's right.
Thank you,
Thanks,
Dr. Drummond.
Yes, you're welcome.
Good to see you. Well, performer.